Hi everyone, I hope you're doing well. This is the second episode of Hypnosis in 9 minutes, and today we want to discuss about difficult freezing in dentistry. As you may know, some people are resistant to local anesthetics in dentistry, and this is the focus of this 9-minute conversation. So some people can never go numb. They are resistant to local anesthetics, and it can be challenging to the dentists sometimes. So what's the mechanism of action of local anesthetics? There are sodium channel blockers. As you know, there are some sodium channels in the membrane, double lipid membrane of the neural cells. And the role of sodium channels is to transport sodium outside the cell and bring potassium inside the cell. So in exchange of 3 sodium outside the cell, they transport 2 potassium molecules inside the cell. And what happens with sodium channel blockers is they block the channel, and that's why they affect the action potentials. And when they change the action potentials, the pain is blocked. So to overcome the resistance to local anesthetics, dentists use different techniques. Some dentists try different sites of injection, and sometimes it works. And they use different medications, different local anesthetics, and sometimes it works and sometimes it doesn't. Sometimes the infection, the local infection is responsible for resistance to local anesthetics, but sometimes you never discover what's behind the resistance to local anesthetics. There are some explanations. As mentioned, one of them is local infection. The other one is anatomical variations, because the nerve is a little bit different in terms of location in some patients, and that may cause resistance to local anesthetics. The other thing is a mutation called missense mutation. It's a mutation affecting the sodium channels, and it is called sodium 1.5 mutation, and it changes the dynamics of sodium channels, and it is attributable to the resistance to local anesthetics. But this presentation is about my own explanation of resistance to local anesthetics. My model is based on sensory and affective components of pain. And when the equilibrium is not balanced enough, the local anesthetics cannot work. Let's dive deeper. So let's say there are 2 components of pain. One component is the sensory component, and the other component is affective component. Sensory component is very simple, and it's a simple cognition created by the stimuli. When the sensory component goes up to the limbic system, to the cortex of the brain, a very sophisticated metacognition is created. That is called the affective component of pain. And it's very hard to say each individual pain signal is sensory or affective, because it's on a spectrum, and each pain has 2 components in different variations, but this categorization simplifies and gives us an idea why some people are resistant to local anesthetics. This is an illustration I've created to discuss the interaction and the dynamics between the sensory and the affective component of pain. This category is before hypnosis, and this category is after hypnosis. As you see, the stimulus is the same. I just scored that as 10. So before hypnosis and after hypnosis, the stimulus is the same. And this one, the orange color, is representing the sensory component of pain. As you may see, after hypnosis, the sensory component of pain is changed. It is decreased, but it is slightly decreased. So it is from 10 to 8. But the most important part is the affective component of pain. Before hypnosis, it is high, but after hypnosis, the affective component of pain is decreased dramatically. And that's the reason behind why hypnosis is very strong when it comes to resistance to local anesthetics. So it changes the sensory component of pain, but the strength of hypnosis is to work with the metacognition component of the pain, or the affective component of pain, and that's why it's a strong modality for resistance to local anesthetics. And when do we need to start the hypnodontics in a clinical setting, or the application of hypnosis in dentistry? As soon as the patient steps in the office. So maybe the front line is not the dentist himself or herself. Maybe the receptionist or the dental assistant is the first person. So most of the dentists know their patients and know some of them are resistant to local anesthetics. So it makes sense to create a plan to start the process right at the beginning. Years ago, I've created this organization, Hypnodontics Canada. It's a division of Trita Hypnosis, and its focus is on hypnosis in dentistry. Thank you for listening. Have a good day.